Hi. All of those of you who've been asking us questions on the Facebook page today, we're doing something a little different. We're going to be answering them, I'm going to be answering them live now as opposed to typing them up on the Facebook page. So the questions that are being answered right now are live as we speak on our Facebook page. So let's have a look at a couple of questions. I really enjoyed Denise's question. She said she's very concerned because she went to a 4-year-old party and all the moms were talking about speech therapy and occupational therapy and play therapy. And she wants to know, is it the norm now that all our 3 to 4-year-old boys need to go for therapy? You know, it's a very relevant question that you ask, Denise, because there definitely has been an increase in the number of children that we see in therapy. I am an occupational therapist, so yes, there is an increase. And what is that due to? Well, is it a fad? I do think that there's a certain amount of it where in this society saying there's a bell curve and everybody needs to fit into the norms, and if they deviate from those norms, they need therapy. And I don't agree with that. I think that deviations from the norm are often very positive things. There's some wonderful books like Indigo Children that talk about how these children that live on the fringe are actually fabulous. So no, not all children need to go. The second thing is there's a massive diagnosis of ADHD, and so if that is the reason why those 3 to 4-year-old children are going. I would also have an issue because kids of that age need to have very high activity levels in order to explore the environment. So certainly there might be an amount of over diagnosis and over referral. Having said that, what we do know is that early intervention is very important. And so children who are seeing early enough in therapy often do a lot better later on. And so if the school is picking up something like a significant fine motor difficulty, I certainly would be having it looked at by a therapist. But you know, I think that the truth is that what sits right with you is probably what is right. And so think about it very carefully according to your child and try and go with your own gut. Good luck, Denise. All right, the next question on our Facebook page is from Veronica Buerters, and she said her 15-month-old doesn't want to fall asleep alone. What can I do even if we sit next to her bed? She just wants to get up. Now, 15-month-olds are doing exactly what 15-month-olds need to do, which is push the boundaries. And the thing with toddlers is that they need boundaries because they need to know what they can get away with and what they can't, and also what's okay within their family and what isn't. And if staying in bed for you is something that's important, I would reinforce the boundary and make sure your little one stays in bed. And you can use what I call my ABC approach. So the A is acknowledge, say, I know you want to get out of bed. B is give her the boundary, but we're not getting out of bed. And C is to say, you've got a choice. You can stay in bed, or mommy will sit with you, or mommy needs to go out of the room. And so you give her options, but they're options that she needs to work within. Good luck with that. And then we've got from Pushava, my son isn't sleeping through the night and still wakes up at 2 a.m. for a bottle for any advice. Well, the 2 a.m. bottle, you don't say what age your baby is, but actually that can continue for quite a while, even after 6 months. It's the one time that we often do see one single night feed happening. So if your baby is anything less than 8 months of age, it is possible. But I certainly, if your baby's over 6 months of age, you can just focus a little bit on increasing that protein and see how you go. Let's have a look at some of the other questions that are coming on, mums. I'm just moving over to my Facebook page to just pick up a couple more for you. Right, so here is a question from Anita. Anita says, hi Meg, I've got 2 questions. My 15-month-old is becoming a bad sleeper. After I put her down in a cot, once she's asleep, she wakes up as soon as I put her down, and she was a colic baby. So she's probably one of those babies who needs movement to fall asleep, and you'll need to start weaning her off that. And so you can sit with her and again give her the boundaries that I was talking about just previously of, I know you want to get out of bed, or I know that you want to be bounced to sleep, but mommy's not going to bounce you. Mommy will lie with you, or mommy will sit with you, and giving her choices. Anita, your other question is actually very interesting because you said, second question, my 4-year-old is having emotional issues and sleeping issues at the afternoon sleep. I've taken the test to see online, and none of the questions describe her. Please help. Okay, so 4-year-old not wanting to sleep in the afternoon, that's completely normal. So what happens is that between about 2 and 5 years of age, very wide space, very wide range, a toddler will actually stop sleeping in the afternoon. And so what I do say is that if your toddler is under 5 years of age, try and encourage a rest time. So even if that's an hour of just lying down and having a good rest in the afternoon, that's fine. But it is possible that at 4 years old, your little one is starting to resist those day sleeps. Then there's one from Tashana, and she says, "Hi Meg, my almost 3-year-old son does not eat any cooked food. He lives on yogurt, dry bread rolls, bananas, and some dry cereals. We've been to see a nutritionist and tried daily to encourage him on different foods, but he won't budge." Now that's a very interesting one. That's a very, very common issue when it comes to fussy eaters. We call them white eaters. If you have a look at the foods he's eating, which is yogurts and dairy, bananas and breads, he's actually sitting on all the white food. So really high gluten, high dairy diet, and very little green, very little color, and very little iron. So one of the things that I would do is I would definitely expose him to food, to variety in every single meal. So lots of color on the plate, even if he doesn't eat it. What we know is that for some kids, when they're fussy eaters, they just need the exposure and will eventually move on to that food. So definitely exposure would be an important thing. The other thing I would suggest, Tashana, that you can do is to actually go onto my Facebook, onto my website, and you'll find a questionnaire that has a look at what sensory personality your baby is. And your baby's sensory personality may be a slow to warm up personality, and those babies don't like variety, they don't like change. They also do like control. So what you can do is you can put one extra new thing on his plate. So let's say it's strawberries today on the side of his plate. Make sure that that is the food that he might look at. And if he's just handling it and then throwing it on the floor, that's fine. A couple of meals later, he'll actually start to handle it, pop it in his mouth and spit it out, and eventually, hopefully, pop it in his mouth and eat it. And you can encourage him and say, you don't have to eat it, you just have to taste it. And slowly but surely, with your slow to warm up child, they will realize that the food that they're looking at is not dangerous. All right, so let's have a look at a couple more of your questions that are coming through. Here's a question that is through from Ansu. She says, "Hi Meg, my 4-year-old son is now, my 4-month-old son was born prem at 34 weeks. So he was born 6 weeks prem, and you always adjust for that. So he is 4 months, so we would consider him a 3-month-old baby now. And we're having a terrible time to get him to sleep for long periods in the day. And just getting him to sleep is a mission. Any advice?" Well, the first thing, to get him to sleep, I would watch that awake time. I would make sure that he's settling to sleep after about an hour to an hour and a half of being awake, so that he really is not overtired when you put him down. And secondly, I would also just be aware that at that age, they could only have 45-minute sleep cycles, and that could be normal. Often for very little babies, they've slept for very long periods of time, like maybe from one feed to the next for 2 to 3 hours, and then suddenly at about 4 months, 3 to 4 months, they shift, and then they're waking up after 45 minutes, and we look at it and go, what are we doing wrong? Why are they not sleeping for 3 hours? But the reality is that that's age appropriate. It's a 45-minute sleep cycle. And as they approach 6 months and they have a good lunch, you'll see that they'll start to lengthen that midday sleep. So good luck, Ansu. And then from Trisha, she says, "Hi Meg, my little boy is 4 months old. When is the right time to put him onto solids, and what are the signs that he's ready?" So what we do know about putting babies onto solids is that ideally we want babies to be exclusively breastfed until 6 months of age. And if your baby is very comfortable on breast milk until 6 months old and sleeping really well and content between meals, I wouldn't actually put him onto solids at all. However, the other thing we know is that introducing solids anywhere between 17 weeks and 6 months of age does not increase a child's risk of allergies. It doesn't increase their allergy profile in any way. So if your baby is showing that he's not satisfied between feeds, and you have attempted to increase the number of feeds just to see whether or not he'll settle on milk alone, you can then have a look at introducing solids. I do recommend that you see your clinic sister, who would advise you personally on your baby, and also on what type of foods to start on. Good luck with that, Trisha. All right, now we've got something coming through on Twitter here, not on Facebook, and that's from iCandyWP, and she says, "Hi Meg, my 7-month-old baby sleeps through the night since 8 weeks. But since starting solids, he wakes up at 3 a.m. How can I help him to sleep through again? Well, he's a really good sleeper. And what we do find is that many babies do that 3 a.m. Waking, and they don't generalize it to the rest of the night if you do feed them. So I would actually feed him that 3 a.m. bottle or milk feed, and then especially if he goes straight back to sleep. If you're concerned and he starts to bring it earlier, which I truly do not think he will, or if you really don't want to get up for that time, you can offer him a little bit of milk, or you can do some sleep training to get rid of that feed. But actually, a single night feed of milk in the middle of the night really isn't a train smash. So good luck with that, Candy. All right, let's have a look at a couple more questions that are coming through on the Facebook page, coming through thick and fast right now. This is from Anna Dean. She says, my 16-month-old doesn't seem to sleep through any longer. So this is 16 months old and wakes at least twice at night crying. And also when she goes to bath, brushes her hair or teeth, you just need some guidance on what you can do to stop the crying. Okay, so 16-month-old, I would probably deworm her. She might have a worm infestation, so I would look at that. And then I would also just check out her health in general. Does she have eczema on her skin? The fact that she's resistant to climbing into the bath, her skin might be a little dry. So moisturize her skin, deworm her, and then just check out her health in general because this is a new thing. If the other thing I would do is would just check what's going on in her diet. She needs a lot of protein. She needs to bulk it up there. And so I would have a look at introducing the extra solids there as well. And then, of course, the most important thing with a 16-month-old is that they're able to settle themselves to sleep. And one more thing, and indeed that is actually very important, is that between 12 and 14 months, babies need to drop from 2-day sleeps down to 1. If you haven't done that and your little one is still having 2-day sleeps, and they might be having too much sleep during the day, so drop to 1-day sleep, and that could also sort that out. Right, going back to Twitter, Candy says, I've got him to sleep by following the tips from your Sleep Sense book and using the same bath routine as suggested from day 1. Well, that's really good to hear. But as I said, that one single night waking at 3 a.m., Candy, I wouldn't actually be worrying too much about that, although you can sleep train if you would like to. Going back to a couple more of our comments that are coming through. This one is from Simone, and she says, hi Meg, my little man is 28 weeks. So he's just over 6 months. He has a cold at the moment, but for the last few nights he wakes us a few times after 12. I'll breastfeed him as that's the only thing that calms him down. And the doctor and his ears are fine. Then he will wake up 2 to 3 hours later. Could it be teeth? He's extremely clingy, won't let me leave his room. We resort to co-sleeping. Yeah, Simon absolutely could definitely be teething. He might be feeling a little bit uncomfortable. So if he's gone off his food as well, if he's got that kind of acidy smell to his poos and his nappies, and maybe a lot of drool around his mouth, and maybe even some dry skin around his mouth area, he could very well be teething. And then you want to deal with the teething as it comes up. So you want to actually give him some sort of painkiller in the evenings, paracetamol based, or rub some teething powders on his gums. Because he probably is teething. That could very well be the reason that he's not settled. Okay, we've got a flurry of questions coming through now. This is from Jenna. She says, hi Meg, my 1-year-old has started freaking out whenever we put him in his high chair to eat. Pushing boundaries, Jenna, that's what they do. He won't eat any of his usual favorites and scream until we lift him out of the chair. He won't eat finger foods either at all. All he'll put near his mouth is his bottle and flings. This has been going on for a week now, and he struggles. And the struggle is wearing my hubby and I thin. He's had a cold recently, but otherwise healthy. No teeth seem to be coming through. Is it just a phase? Is there anything we can do? He used to love his food. So 2 things are going on. The one thing is that he needs to have a very active appetite to eat, because toddlers survive on fresh air if their appetite is decreased. So what you need to do is stop the flings and all snacks altogether. So he can only have his solids. He's a year old, so he should only be having 2 milk bottles, which is 1 at breakfast or before breakfast when he wakes up, and 1 at bedtime. Any more than that will destroy his appetite, and nothing at night either. So limit the milk, limit the snacks, and activate that appetite. Step 1. Step 2 is the aversion to the high chair. Now, there you've got 2 options. The one is that you can move him to a table and chair, a little toddler's table and chair, and there's nothing wrong with that. Just make sure you decide on where he's got to sit. So if he's going to sit on his chair, or if he's going to sit in his high chair or in the little chair, that doesn't matter either way. But you have a firm boundary. So you say to him, I know that you don't want to sit in the high chair, but you have to sit in the high chair because this is where we eat lunch. And then you follow through, you give him a choice that if he doesn't sit in the high chair, he needs to go into a timeout or he needs to do something else. So you need to have some sort of discipline plan for those circumstances. All right. Then from Inalda, hi Meg, my little girl will be 10 months old and isn't crawling yet. Is there any need to worry? Is it possible that she could skip crawl and only start walking? Any ideas on how to encourage crawling? Anelda, I don't like it when babies skip crawling. They can do it. They certainly can go from sitting, bum shuffling and tummy crawling straight into walking, but I prefer them to crawl. That's the occupational therapist in me. So a couple of activities you can do. The one is to take a little towel and roll it up and put it underneath her chest, lift up the ends of it, and then move her forward to help her see the crawling motion. That would be a good idea. Also, in a sitting position, put toys just to the right or to the left of her so that they're just out of reach, so she has to lean over, and you'll find one day when she leans over, she gets into that 4-point kneeling position. We had a little break there, and I'm back. All right, and this is the second last question that I take, and the rest I will then answer back online. The question is, Meg, at what age can I start sleep training? My son's 5 months old and has been waking every hour for the last 6 weeks. I'm at my wit's end. He has 3 naps and 3 meals. You know, Danelle, I don't think it's quite time to start sleep training. I think you first of all need to rule out everything else that's going on. And I really do suggest you get hold of Sleep Sense, which has got the 8 steps that you need to do before your baby goes on to sleep training, and really rule out all the possible causes for night wakings before you go on to sleep training. And certainly, if he's waking up every hour for the last 6 weeks, there is something going on, and I would probably have a look at his ears and his health before looking anywhere else, because 6 times at night is not, every hour through the night is not normal. All right, and then the final question for our live vlog, and thereafter I'm going to go back onto our Facebook wall, is from Duduzile. And she says, hi, my baby's turning 9 months old on Sunday. He's not crawling and not yet teetering. Is it normal? So he's not crawling at 9 months. That is on the late side of normal. So, you know, I would say that you need to encourage him to crawl a little bit more. Make sure he has lots of tummy time. Think about the activities that I just gave to Danelle, and I wouldn't worry too much, but if he's not crawling by 10 months, I would look into it. One of the questions that came up from another mom also on the page was whether or not an 8-month-old who's not sitting, whether or not there's an issue there, and that's different. That one really does need to be checked out. So not crawling at 9 months, I'm not terribly worried. Not sitting at 8 or 9 months, I would be worried. So I hope that helps you out, and thank you very much for joining me. And this was our first ever live baby meetup, and it really has been fun chatting to you all. So I'm going to carry on the wall now, and we'll see you next week. Thanks.